To my fellow speakers, ladies and gentlemen, thank you very much for inviting me. My other panellists are here because of their undoubted and very obvious expertise in this field. I think I'm here through nepotism. Hello, Jane. My sister's here. I wanted to talk today about a couple of things, and the first one is about some of the responses to obesity, and then I'm going to talk a bit about obesity itself and perhaps how we should think about it. So, just in the paper this morning, there's yet another study. This one's about fast food labelling, and some students were given some opportunities to look at some labels and see whether that changed what they bought, and it did. And there's been quite a lot of these studies where if you give people information about the calorie content of food and you tell them how many calories you should eat, and then you sort of say, well, you're eating your whole day's worth if you eat that cheeseburger meal, people make different choices. Almost invariably, there's two things wrong with those studies, and I'll just mention the one that came out today. It was university students who are not the usual cohort, if you like, for whom large amounts of... they're more likely to be changed by that behaviour, I suppose, is the first thing. But the second thing I'd like to say about them is often those studies, that one was a real life, what they ought to study, but often those studies are pick things in theory, and in the case of food policy, we all seem to say we all know what we're meant to say when we're asked. We tend to make different choices when we're in the privacy of our own supermarket or our own KFC. So I just sort of put that out there in terms of studies. And that does actually bring me to fast food labelling, because it's one of the ways that people talk about how we can change people's consumption. Now, in Victoria, both McDonald's and KFC label all of their menu items with how many kilojoules they have, and they also have on their menu what the total kilojoule for an average man should be. And my key argument is I agree with almost everything that was just said before, because companies don't do this altruistically. They're not compelled to put the kilojoule count on in Victoria. They do it because they know it doesn't make any difference. They know they can do it and get the psychic benefit of doing it, and it's not actually hurting their business. So when we talk about regulation and when we think about how we should regulate this, if at all we should, we need to be careful that we're actually doing things that aren't just going to make us feel good, that will actually work. So if we talk about packaged food labelling, and in a previous life, I was in fact a retail analyst, and I can absolutely attest that they spend a huge amount of time, all the things that Allessandro has just said, working out how to make us spend more on packaged food, or more in the store. More recently, they're quite happy for us to buy vegetables as well. They do this, they spend a lot of time on it. But I want to talk specifically about nutritional labelling, which is of the food itself, and some of the proposals which I'm going to do traffic light labelling, because that seems to keep coming up. And I thought I'd share with you a recent, it was late last year, the Tory government in the UK, so I don't want to say that the right is immune from bringing in these things I don't like. My sort of governments seem to do them just as much as left-wing governments. Decided that they would like to bring in traffic light labelling. Now, Italy has complained to the EU about this. And Italy's National Confederation of Farmers has gone complaining to the EU because foods such as extra virgin olive oil get a worse rating under virtually any traffic light labelling system than Diet Coke. And because Diet Coke has no sugar in it, extra virgin olive oil has a lot of fat in it, And that's how those things work. They're macronutrient based, and so olive oil comes out worse than Diet Coke. And unsurprisingly, the Italians complained because all of the great things about Italian cuisine, Parmesan cheese, prosciutto, olive oil, don't work out so well under that system. And in fact, the similar proposals in Australia have received a similar response from the olive oil producers here. And they have come out to note that on the Australian proposal, margarine gets 3.5 and extra virgin olive oil only gets 3. So again, people like these schemes. They think that they might be the saviour of us, but that they do have anomalies in them that are very hard to fix without just making quite judgments about, well, that's no good because it's processed and that one's not. And that's not the basis of the diet. It's whether, how many calories they've got or how much fat they've got in them. I would just say another thing about traffic light labelling. In this country, one of the now supporters of the modified scheme is the Grocery Council of Australia. Now, they did oppose the previous scheme, but they are now are in favour of the current one. I think it's always very interesting when, like the McDonald's in my first example, when you have the Grocery Council, which are the big Kellogg's and those sorts of people, when they're in favour of it, we have to think about why. Now, in this particular case, I don't think it's because they think it makes no difference. I think it's because it gives them a competitive advantage. If you are Kellogg's, you change your packaging really easily because you do such high volume. But you compete against Carmen's Foods, to take a breakfast cereal example. It is very expensive for Carmen's Foods to change their packaging each time the law changes in terms of labelling. And the big manufacturers know that when you have labelling changes and you make it more difficult, the losers are small regional producers. There's quite a lot of evidence that it costs the big guys about 0.2% in margin, and the labelling changes cost small producers 4% or more. So that brings me to the fat tax. Denmark had one, it lasted a year, and they repealed it. There's really only one thing I want to say about that, because it goes to my point about it's not always left-wing governments that do this. A right-wing government introduced that fat tax. It didn't work because, for a number of reasons, but one of the reasons was Danes went across to Germany to buy the things that were therefore cheaper in Germany because they weren't taxed. It is a trouble when you have sort of borders that you can, people make choices, and they wanted to have that higher fat food, and they went and they bought it. It was a left-wing government, a coalition of the Social Democrats, the Social Liberals, the Socialist People's Party, and the Red Greens, who repealed it. So there's one other thing I suppose I wanted to talk about before I just get very briefly on to... How much longer have I got? 20 minutes. 20 more minutes? Yeah. Wow. You don't have to use it. I'm a politician. And one of the things I wanted to talk about was the fast food industry and the packaged food industry are not the only self-interested players in this. And so when we're thinking about regulation, or when we're thinking about the costs of obesity, in Australia, for example, the report that came out, it came out a few years ago, that came out with a figure of 58.2 billion, which was back in 2008, was when that came out, and it's been ratcheted up since. That study, that figure, came from a study paid for by a diet drug company and commissioned by an organisation that receives grant money and donations based on the government and donors' perception of a massive problem. Now, could I say if we were talking about climate change, or we were talking about tobacco, or we were talking about a whole lot of other issues, if the study was paid for by somebody like, you know, the tobacco company or a big oil company, we'd be pretty dismissive. Yet the key study that is the basis of the economic evaluation of what obesity costs us in this country was paid for by a diet drug company, La Roche. Thank you. I thought I seemed to have been talking for a while. So now I'll briefly talk about what I think is wrong with our approach of thinking about obesity as... I don't even think we get obesity right as a health problem. And by that I mean there's a couple of things. Now, where did we get... Obesity, as it's defined, means that you have a BMI over 30. So why is it 30? What is a BMI? Why is that the thing? So the BMI came from a Belgian astronomer in 1840-ish who wasn't particularly interested in obesity. He was actually interested in what in sort of some statistical stuff. And what he did was he got all of the recruits for the French army, conscripts, and calculated their height and their weight, and then just said what was the average of that. And that was regarded as normal. Now, in the 1840s, your average French army conscript was malnourished, had an average life expectancy of under 40, and that is the basis on what constitutes a normal BMI. And then in the 1940s, one of the big American life companies adopted this as the criteria for what they were going to do for life insurance policies. Women on a mass scale have never been measured to see whether they have the same health outcomes, and most of us would think that women can carry a bit more weight than men, and in fact the data shows they can for heart attacks and that sort of thing. Yet we all are subject to the same thing. And why is 25 the magic number? If you're over 25, you're overweight? Well, it used to be 30 in the US, and then there was an organisation called the International Obesity Task Force, which is part of the UN, and they managed to get the UN to adopt 25 as the cut-off point for being overweight. And then, because the UN had done that, then America followed them. And so one day, I'm just trying to find the right stat, it's quite impressive, 37 million Americans became overweight overnight. I would also note that the International Obesity Task Force is also funded by a drug company, La Roche. So just to make us all feel a bit better, because I could tell you I haven't got a BMI under 25, there's been quite a lot of studies done about where do the effects of being too fat kick in. And many of you will be pleased to know, I know I certainly am, if you are in the overweight category, which is 25 to 30 on the BMI, your life expectancy or chance of dying from all causes is less than if you are at the bottom end of the healthy range or if you are underweight. It is absolutely true that if you get very fat, if you go into type 3 obesity, which is otherwise known as morbid obesity, you are going to be pretty sick. There's no question about that. But the healthiest place on the weight spectrum is, in fact, in the overweight category. So we need to think about, when we have bombarded at us that 2/3 of us are too fat, well, are we? Should we be doing something about something that isn't a problem? Shouldn't we instead be looking at the people who have type 3 obesity, morbid obesity, and say, what can we do to help you? Because they're the people who are ill. They're the people who need to be stopped getting fatter. going into the super obesities. In conclusion, I live in a place called Ararat. Now, Ararat is famous for a number of things, but for the topic we're talking about today, it's perhaps most famous for being the town that was the fattest in Australia, who then became the biggest loser town. Now, the most recent Who's the Fattest Town, it's still a regional town, it's Shepparton, but we're not even in the top 10 anymore. So what did Ararat do that changed its behaviour and changed those stats? And what didn't it not do? Well, I can tell you that it didn't put in a fat tax, it didn't change the labelling, it didn't do any of the policy prescriptions that are often thrown at government. What it did as a community was change the conversations that people had with each other about what was acceptable. It wasn't a sort of, oh, you're no good because you're too fat, or it was actually the opposite of that. It was how together can we change our behaviours to be healthier as a community? And it's worked. We have still the same amounts of footpaths and parks and things that we always had. People use them more. We have the same amount of fast food as we always had. People make slightly different choices. It's not always about what the government should do, and I know I've been asked to speak here because I've written on this. I think you would have heard from what I've said, I don't believe that this is the preserve of one side of politics. I think this is not that, shouldn't be that kind of conversation. I have similar conversations that I'm having with you within my own party, the Liberal Party, and I just think that as a society we need to concentrate on who are ill, where are the problems, and look at those people rather than saying, oh, we have this moral panic around a crisis that may not even be there. And secondly, that whenever you come across somebody saying to you, we need a new law about this, please think really carefully about who benefits. Who benefits, because it's not always the obvious one. And so, I wondered why you all completely lost me. I didn't think I got any more boring. So on that, I will finish. Thank you very much for having me. I'm looking forward to a very robust discussion. I know everybody is very passionate about this topic.